In Module 2, we'll discuss the 3 stages of stress and the mind-body response to stress. It is natural for us to try to deny that we're under stress or pressure. We all like to think we can work harder and longer in order to get the job done. We often ignore the signs of stress creeping up on us and truly believe we can overcome stressful situations rather than pull back and take a break. For example, sometimes in a stressful work environment, an employee will work nights and weekends even when they don't have to in an effort to deal with work-related stress. The person pushes themselves to a point of exhaustion, decreasing their efficiency and ability to actually get something done. Sometimes just taking a break, doing something else, or getting away from the office may be the best way to reduce stress. Learning to identify the symptoms of stress and learning to identify when you're experiencing denial is crucial. Understanding the stages of stress can help you do this. The stages of stress are alarm, resistance, and exhaustion. Let's talk about each of these stages in more detail and look at typical symptoms and a practical example of these stages in the workplace. As you begin to experience a stressful event or perceive something to be stressful, physiological changes occur in your body. This is the alarm stage. This experience or perception disrupts your body's normal balance, and immediately your body begins to respond to the stressors as effectively as possible. You may experience physical symptoms such as cardiac, increased heart rate, respiratory, increased respiration, skin, decreased temperature, and hormonal, increased stimulation of adrenal glands, which produce an adrenal rush. You may also experience emotional symptoms such as anxiety, restlessness, anger, fear, and depression. During the resistance stage, your body tries to cope or adapt to the stressors by beginning a process of repairing any damage the stressor has caused. Your friends, family, or coworkers may notice changes in you before you do, so it's important to examine their feedback to make sure you do not reach overload. Behavior symptoms include lack of enthusiasm for family, school, work, or life in general, withdrawal, change in eating habits, inability to sleep or too much sleep, anger, and fatigue. Cognitive symptoms include poor problem solving, confusion, nightmares, and hypervigilance. Emotional symptoms include tearfulness, fear, anxiety, panic, guilt, agitation, depression, and feeling overwhelmed. During the exhaustion stage, the stressor is not being managed effectively, and the body and mind are not able to repair the damage or cope with the stress. Physical symptoms include digestive disorders, headaches, high blood pressure, and ulcers. Behavioral and emotional symptoms include unusual or erratic behavior, withdrawal, loss of temper, loss of self-confidence, and emotional outbursts. Dr. Hans Selye, known as the father of the field of stress research, provides this practical example of the stages of stress in his book, The Stress of Life. In this example, we can see typical reactions and symptoms to the loss of a promotion at work. The impact of stress in this situation can potentially be reduced by identifying and accepting the feelings experienced in the alarm stage, avoiding the desire to isolate and deny in the resistance stage, and by seeking help from a professional in the exhaustion stage. It can also help to share feelings with a trusted friend or confidant to help get a new perspective. Let's look a little deeper at the mind and body's response to stress. As mentioned at the beginning of this course, stress can be defined as the mind and body's response to a real or perceived threat, event, or change. So, what does that response look and feel like? When you return to the Module 2 class content area, you'll watch a short video from Pfizer on how the mind and body react to stress. But for now, here's a brief summary. The stress response pictured on this slide can help us perform under pressure. However, our body doesn't always reset itself to normal. What we know is that over time, stress has been shown to have a gradual damaging effect on multiple body systems. This includes our digestive tract, circulation, lungs, and muscles and joints. Constant stress also speeds up the aging process. So, what does stress feel like? Just as we each experience stress over different things, we each feel stress in a different way. While some people worry and become easily distracted, others may have sleep difficulties. Learning to identify these feelings and understanding their source is the first step in learning how to effectively deal with them. This concludes Module 2. Please close this presentation to return to the Module 2 class content area.